I'm Dr. Mollie Marti, and welcome to Resiliency Matters. What if you could learn from an expert who works in schools and in jails and in communities to build resilience? Would you spend the next 28 minutes with us? What if in the next 10 minutes you could hear why it's essential to pair any conversation about childhood adversity with a conversation about resilience and thriving? Would you hang out with us? Who is us? My other half today is Dr. Allison Jackson, who is joining us from Virginia. Allison is an expert in childhood adversity experiences, and she is CEO of Integration Solutions. Welcome, Allison.
Thanks so much for having me.
So I already flipped around the ACEs and adverse childhood experiences.
You got it.
I need to keep it right because we use that acronym so often that I'm not used to saying the full term. But tell us a summary to kind of understand our starting point with childhood adversity.
Sure. Adverse childhood experiences is a set of childhood traumatic experiences. It doesn't represent all the types of things that can happen to you in childhood, but the research is very profound. And so when they looked at what were things that could happen to you before the age of 18 that really created a dose response, which meant more adverse health conditions happened to you as an adult. And they came up with the top 10 of this regression model they did, right? And so the first section was emotional abuse. Did you experience emotional abuse prior to 18, physical abuse, sexual abuse? Did you experience emotional neglect, feeling unloved or unwanted in your family? Physical neglect, not necessarily poverty, but I'm afraid I'm not going to have a place to sleep tonight. I'm afraid I won't eat tonight. And then looking at what they call household types of dysfunction. So separation, divorce, death of a caregiver, someone in your home who perpetrates domestic violence, originally towards a female in the household, a mother figure, but now we know any interpersonal violence is absolutely traumatic. Someone in a home that's in jail or prison has a mental health challenge or diagnosis, a substance abuse challenge or diagnosis. When those things happen prior to the 18, there's some significant risk that exists to us as adults.
Okay, so we end up with an ACEs score of 0 to 10, and the research shows that when there's 4 or more ACEs, those risks increase. Talk about that.
Absolutely, and so it kind of goes back to that dose response. So I think about public health issues like don't text when you drive. Why do we care about that issue? It's because we know the more often people text, someone can really get hurt, someone can die, right? So when we look at that dose response, when you move up to a 4 on that scale of 10, like you said, I'm 550% more likely to become an alcoholic. I'm over 1,100% more likely to get addicted to an IV drug like opioids or fentanyl. I'm more than 300% more likely to get depression. I'm more than 1,500% more likely to attempt suicide. And at a 6, I'm more likely to die 20 years younger than my counterpart at an average age of 60 instead of 80. So it's a pretty significant health issue.
Yeah. And as much as we know about ACEs score, we also are starting to look at scores beyond just I'm a number.
Yes, and so I think that is such a critical piece because this was a research tool. It was never meant to be a screening tool, and that's a mistake many people are going out. This is not something that we want to run out to children and interview them of did these 10 things happen. There are trauma screens for that you can find depending on what you want to do. This was research done on adults to really look at what is one layer of why 7 out of the 10 leading causes of death are happening. So it's one piece, but it's not the only piece, right? And so some people like Dr. Paulanuras out of the University of Washington are starting to do some really interesting work where not looking at, for example, I have an ACE score of an 8, right? So it's pretty high. But you knowing that I'm an 8 doesn't tell you a lot about who I am or my story or my resilience or my path. It's one piece of who I am. So Dr. Paulanuras is doing cluster work where we look at, well, what was your adversity as a child? What was your adversity as an adult? What resilience factors were in there? And how do we create profiles for people so we know what type of resilience interventions will help people with different types of lived experiences? And I think that's so important because people like myself and others in the field made the mistake of, what's your ACE score? That'll help us know everything about you. And it's one number, an important one, but one number.
And I see that often when schools get ACEs training and then they start teachers walking around and going by a number. And so this is really important work. Another approach you are really excited about is the NEAR approach. Let's
Yes.
talk about that.
So I get really excited about Laura Porter. She's also out of the state of Washington, but works in lots of different states now. And she kind of coined the term NEAR. Gotta love us academics. We make things nice and complicated. So NEAR stands for combining 4 sciences: neuroscience, epigenetics, adverse childhood experiences, and resilience. So really bringing those sciences together and asking some hard questions. So they looked at the BRFIS, the Behavioral Risk Factor Surveillance System. I just tried to get that right, the BRFIS, from the Center of Disease Control. And they didn't just ask the question, what are people's adversity in childhood? They actually asked the question, what helps people when they've had adversity in life? And they came up with 4 things that really showed up in the data to be things that really supported and promoted resilience. And those 4 things were, the first one was building people's social emotional competence. So what is that? Building people's social skills, teaching people emotional literacy and being able to express emotions and ask for what they need. Teaching people hope. And so hope not as a feeling, but as a sense of future self. And then I love this one, that we need concrete supports. These are not Facebook friends. So concrete supports are, I don't know if I can feed my kid tomorrow. Who am I gonna call? My child has been screaming for 3 hours and I want a shaker. Who can I call? If I miss my job tomorrow because my child gets suspended, I'm gonna lose my job. Who do I call? And people who tend to have an ACE score of 6 or more rarely can name one concrete support in their life. And so we've got to increase concrete supports. The next one is what we call community reciprocity. And so I love community reciprocity because it is about how do we get someone's primary network surrounding them to support them, the people they see every day.
Excellent. And you also are not only a fan, but a practitioner of the narrative-based approach with Dr. Brené Brown.
Yes, I am a huge fan of Dr. Brené Brown. She's done lots of different kinds of work, but one of her pieces of work, she's spent the past 20 plus years studying shame and resilience, and so she's really just studied what helps build shame resilience and how we can use that, and that's critical with folks who've had trauma, who've had a lot of shame of, I'm bad, I'm not good enough. So wonderful work to look at and use.
Excellent. We're going to talk more about Brené's work coming up. Awesome. For now, here is your first tool. While we must continue raising awareness about adverse childhood experiences, it is essential that we pair this conversation about resilience and thriving. Allison's personal resilience story when we come back.
Today, Mediacom is answering your call quicker. Our technicians are working harder to get there in less time, every time. And we're adjusting our schedule to fit yours, making more night and weekend appointments available than ever before. We're there, at the push of a button, all 4,600 of us, all committed to the same goal, doing everything we can to give you the best experience possible.
After the rain stops and the wind dies down, when the fire's gone out and the dust settles, we rise up together and become a force of nature all our own. As part of this community, Mediacom stands with you, doing everything we can not only to restore your service, but to help provide emergency communication access, assist relief efforts, and support our neighbors.
Mediacom Internet customers, increase your speed and save on faster speeds up to 1 gig. If you have more users and more devices competing for more of your bandwidth, a speed boost on our fiber-rich network can easily accelerate performance all over your house. Faster speed, faster Wi-Fi, faster everything. Don't wait. Boost your speed to the next level of super fast internet for as low as $10 more a month for 1 year. Call 844-EXTREME5.
Hi, I'm Dr. Mollie Marti, and welcome back to Resiliency Matters. We are speaking with Dr. Allison Jackson today, an expert in ACEs, and we would love to hear what you would like to share about your personal story of resilience.
Absolutely. So, I spent a lot of time actually in residential centers growing up. Between the time I was 13 and 19 years old, I was probably in 10 different residential centers, locked units for kids with mental health diagnoses. I acted out a lot. broke windows, tore down doors, hit staff. Probably not who people see me as right now, sitting on the show with you, right? And I think what's really powerful about that is that you don't always, when you're looking at someone, know their story. And so I always say we're not powerful enough to know what someone can become, but we're powerful enough to actually offer support and listen. And that's what was given to me, is that when I was locked in that institution multiple times, many people who are professionals injected me with Thorazine, held me down in 4-point restraints. I had a nurse say to me, if you ever went out of here at your age, not your shoe size, you'll come through me. For anyone listening, that's not a trauma-informed approach to a kid who's acting out. But there was a man named Howard who had no letters behind his name, was a mental health tech, and he did the most important thing that we can do for children or adults who were dealing with adversity. He made a relationship with me. He cared about me. And then he figured out what my motivation was, which was to tear stuff up. And he went with my motivation. And so he actually listened to my story. And then he said, okay, if what she likes to do is break things, this is what we're going to do. He's like, Allison, I'm going to take you to the gym. And if you can give me a workout for an hour, then I will let you tear everything up in this place for 3, which at 16, I was like, yes. Actually, I said worse than that, but I won't say it on the show. So I was like, yeah. And so what happened, though, is I crawled back to the unit and couldn't break anything. And that was the moment that I broke down and told him my story. And he said to me, you know what, Allison, I think you're going to do something special in your life. I don't think this is your story. I got locked up over and over again to hang out with Howard, which was not his plan. But a lot of times people will find whoever it is they need to get to that resilience, right? And then one day he said, meet me in the lobby. I'll teach you this on the outside. And that really was the beginning of my resilience story. Hard part is I went to college. I went through a rape. I actually broke down, was locked in an adult psychiatric institution. And he found me in that same institution. He left the adolescent ring and he came, and I'll never forget, life-changing moment. He said, Allison, please don't let go of hope, because I'm going to hold hope for you until you're strong enough to grab it. I've got you. Last time I was locked in a facility, last time I attempted suicide, first job I ever had was a mental health tech on that pod. I worked on the same pod I was locked on to help kids like me. And I think that's, for me, the biggest part of this work, is it's not about having letters behind your name or the right letters behind your name. We all have a role in resilience, and we all have the ability to connect with another human being and offer that to them.
Beautiful. And I thank you for sharing that with our audience, and how you so broadly have shared it with your TEDx talk and really mobilized a lot of positive change around that.
It's important.
It is.
Yeah.
And you're brave for
Thank
doing
you.
that. So thank you.
Thank you.
Let's shift gears.
Sure.
Another great researcher, Nadine Burke-Harris,
Yes.
but she has a kind of lighter analogy that you like to shake things up a little. So we're going to use the word diarrhea.
Yes, we are. That's a spoiler alert, right? So what I love is one of the things she says is any public health issue, and I just want to reiterate that ACEs is a public health issue, right? Not just a behavioral health issue. And so what she says is, if I'm a doctor and I got 10 kids drinking out of a well and 9 of them come into me with diarrhea, I can write prescriptions for diarrhea all day long, but my other option is to pay attention to that well, to stop the diarrhea epidemic. And I love it, even though lots of Secretary of Health are like, can you pick a different term than diarrhea, Allison? And I'm like, diarrhea, diarrhea, diarrhea. And they're like, I'm uncomfortable. And I'm like, that's the point. So when people are in crisis, you can't ignore it. You can't pretend it's not happening. And it makes you uncomfortable. We can't ignore folks in that place. But if we don't start figuring out, in terms of policy, relationships, organizations, caregiving, support, how to hold space for the well, we are going to continue to live in a diarrhea epidemic. So my favorite thing to say to people is the next time you're in a meeting, ask the question, are we just going to talk about diarrhea today, or are we going to do well work? And I promise someone will listen to you.
So let's start with the diarrhea talk.
Yes.
All right. What does that work look like in your world?
So to me, I also think of it as criminal justice work, the opioid epidemic, working in our jails, foster care systems, folks that have had trauma after trauma after trauma. And maybe there was an opportunity much earlier in that story for some system, some community organization, some person to reach out, and we missed it because we weren't doing well work. We waited until it was a crisis, and it's costing us financially, and it's costing us in terms of human lives.
I just saw a Hesburgh, a documentary on, and he had made the point: you either pay attention to leadership, or you're managing a crisis, because this is what it's going to be. I thought it was really profound.
Very powerful, same thing. And it's not that you're not going to feel that tug, but I think as we get into other types of what I've learned in my work, I've done tons of diarrhea work in my life. I have lived in that a lot of my life. It's interesting to me now that 80% of my work is well work, and it's been intentional because I want to stop the epidemic. I want to reach people. And it doesn't mean that other work's not important. It's critical. It's not fair that some people didn't get those things earlier, but we can't, like you just said, we cannot lose sight. We have to protect the well work.
So let's get back to Brene Brown's work and the work you're doing in jails.
Absolutely. So I'm very fortunate to work in Chesterfield, Virginia, in the jail, and we have a really progressive sheriff there named Sheriff Leonard, and he wanted to build a recovery jail. And so originally it started around heroin and opioid and fentanyl, and he took a peer recovery model and he put a bunch of guys on a pod together and said, what would you do if you could do different? You support yourselves. You ask me for what you need. It was the strangest interview I've ever been on. So he heard me speak at a conference. Honestly, my bias was none of these sheriffs are going to be interested in what I have to say. He stood at the end of the stage and said, I need to fly you in to where my jail is. You need to help me. And I said, great, where do you live? And he said, Chesterfield, Virginia. I said, that's really funny. I live 15 miles from your jail. And so there I was. So I thought I would interview with him, and boom, he popped me. He said, welcome. He took me to the jail. He dropped me on the pod and left me there with the 20 men on the pod and said, figure out what they would like you to do and if they want you to stay. Very different approach than a typical job interview. And we sat there together. And so the point is many times we do 12-step programs, or we talk about just doing substance abuse education. These are men that have been there sometimes 30, 40 years in and out of jail. And they had never been told about ACEs. They had never been told about resilience. With that data I gave you earlier today, I remember teaching them as peer specialists, teaching them, this is what happens with trauma, this is the effect, this is one of the reasons that you may be addicted to this substance. And when I gave that statistic at a 6, you may die 20 years earlier than your counterpart, one of the guys jumped up and said, Doc, I want my 20 years, give me some resilience. That's what we want. We want people to understand their health and to say, give me the resilience, and learn it themselves.
So you're using the Rising Strong model there, and talk a bit more about the peer recovery.
Sure, absolutely. So I use the Rising Strong model, and then the peer recovery model is now there's men and women pods open. They are men and women who actually go through lots of training in trauma. 100% of them go through a trauma training I do for 6 hours. They actually go through the entire Dr. Brene Brown Rising Strong curriculum, which is anywhere between 16 hours and 20 hours depending. And they have the option to become peer recovery specialists, which is a 70-hour training plus 500 hours of community service, where they actually serve residents who actually live with them. So they are actually providing peer support and mental health support and substance abuse support to the residents they live with sometimes 2 or 3 years, as well as go out in electronic monitoring and help people in their community. So they have a connected community by the time they leave, but are also promoting health and wellness in the residencies that they live in, the jail, the prison.
Now that's well work.
Yes, well work. And diarrhea work, but well work, yes.
Excellent. So here is tool number 2. Beyond addressing crises like the opioids epidemic, we must unleash the power of next generation health by expanding proactive resilience work in our schools, health clinics, our jails, our communities. Human resilience as a public health issue. Stay tuned.
Today, Mediacom is answering your call quicker. Our technicians are working harder to get there in less time, every time. And we're adjusting our schedule to fit yours, making more night and weekend appointments available than ever before. We're there, at the push of a button, all 4,600 of us, all committed to the same goal, doing everything we can to give you the best experience possible.
After the rain stops and the wind dies down, when the fire's gone out and the dust settles, we rise up together and become a force of nature all our own. As part of this community, Mediacom stands with you, doing everything we can not only to restore your service, but to help provide emergency communication access, assist relief efforts, and support our neighbors.
Mediacom Internet customers, increase your speed and save on faster speeds up to 1 gig. If you have more users and more devices competing for more of your bandwidth, a speed boost on our fiber-rich network can easily accelerate performance all over your house. Faster speed, faster Wi-Fi, faster everything. Don't wait. Boost your speed to the next level of super fast internet for as low as $10 more a month for 1 year. Call 844-EXTREME-5.
Welcome back to Resiliency Matters. Today we are speaking with Dr. Allison Jackson, an expert in adverse childhood experiences. You do a lot of work in school, so let's shift gears and talk about some of that.
Absolutely. So I get back to that well work, right? And what is a system that almost every child touches, which is the schools. So what's exciting to me about the school work is that a main focus of almost all schools and states is they are focused on academic engagement and academic success. So those standardized scores and those other pieces, right? And here's the hard part. So we're telling teachers and educators that this is what we want to work on, right? And then actually what the research is telling us is if you don't build social emotional competence, if you don't actually build relationships, if you don't actually focus on those areas, the behaviors to learn won't change. So I think the key part of this slide that's up right now in front of you is that we are actually not doing what helps kids learn. We are telling people and putting intention behind academic scores when the only thing that's going to get us there is actually teaching people emotional and social skills. And so the work that I do in schools is what we call Tier 1 work, which means what can we do with every student that touches a school to support them learning social emotional health.
And it's such an important piece of that to not only be conveying knowledge, but also to be reshaping culture, behavior, attitudes.
Beautifully well said. So it really is a culture change because, again, what I love most is we have a peer coaching model with the teachers. So just like they practice how to deliver math and how to deliver science, what we practice is not just how to teach how to show empathy or how to listen to someone effectively or how to ask for what you need, but they model it. And that's a culture change because most of us in the United States, we're not raised with families that taught us how to speak our emotions and how to actually understand them and make decisions with them. So we're asking an entire workforce to not only teach that to children, but to model it. And that is indeed a paradigm shift and a culture change.
And I know you have seen so many things, so I have great stories from the field. Share a story from a school where you have seen this work really well.
Absolutely. So I think what gets really exciting is there was a moment where a student was actually in what they call Tier 2, Tier 3. So a lot of acting out behaviors. She was being put in a contained classroom. She was having a really hard time. And honestly, the teacher who was with her, he was pretty frustrated. He was like, I think we need to look at an alternative school. And I sat and did an observation. We did some peer coaching. We thought about some ways to actually tone down how loud the classroom was so she could actually ground herself before she learned, ways they could make relationship, and little strategies that he could try on actually having her breathe and then listening to her before he felt that push that I've got to get you to learn this. And he came running back to me, which I never expected the next time I was in the next month. And he says, oh my gosh, she's in the classroom the entire time. We are having conversations. She wants to learn. And she and I both breathed together because I was actually pretty stressed out too. Those are the kind of changes that I think will make a difference for our children and our teachers.
And our teachers. And when that light goes on and they realize that we call it self-regulation, but we don't regulate alone, but in relationship, that's a really important.
It's huge. And it's also so important because the biggest issue I see in schools is retention. You know, and how do we keep our teachers and how do we help them stay in this field of work in a connected relationship? So we've got it. Trauma-informed care is not just about the child in front of you. It is about you as a person who's meeting that child.
And within communities, it's also about the organizations. And you're doing some really exciting work, including with our own Iowa Department of Public Health.
So it's been amazing the last year to work with the Iowa Department of Health. And we've worked inside of the department itself to how do we become a trauma-informed Department of Public Health, as also as all of the partners across the state who are doing some really exciting things. But here's the hard part. As much as I love the word trauma-informed, it's been kind of butchered, to be honest. We're not quite sure what it means. Does it mean that I went to a Saturday class for 3 hours and now I know what trauma is? or does it mean I'm actually using trauma-informed practices in my specific organization? So we took a cue from actually Wisconsin. The First Lady of Wisconsin is really interested in this topic, and she has an interactive map that's done around Wisconsin to think about how do we actually start to categorize what is a trauma-informed organization, and what stage they're at. So we took that as a model, and then it's exciting. We met with people all over the state of Iowa from different sectors and created this tool that you have in front of you to look at where am I in a stage of change? Am I pre-aware? Is it that I need to bring trauma training into my organization? I have some awareness, but I'm not quite sure what does that mean I do? Do I screen? What do I do? Am I being trauma sensitive, which means I have trauma training in place, but if someone has a trauma, I'm not quite sure how to meet that need? Or am I actually starting to become a model for other organizations, and I can take care of my workforce trauma needs as well as others that are in my organization, clients that see me, and I can do warm handoffs. So it really helps you know where you are as a baseline, and then through domain work, very specifically figure out through your strategic plan, where are we trying to go? So that's very exciting work to me in Iowa.
It is, and I know we're laughing, we're kind of breaking every rule there is to put that last slide up on the screen. A lot of words, but the idea is that people can follow along and see that there's a continuum and that we're having this conversation in Iowa and across the country on where we fall and where we can keep moving forward.
And I think that is I don't even say we're on the leading edge of this, we're on the bleeding edge of this. It's still pretty painful. We're figuring this out, and this tool is really about going, where am I right now and where am I trying to go?
So how about the work you're doing in Virginia for a trauma-informed community?
Yes, so that gets really exciting. So part of this is, does the left and right hand know what each other's doing, and how do we actually collaborate? So there's a project I'm really excited about. We have trauma-informed community networks. We have close to 20 now all over the state of Virginia. Those are networks that actually have pulled together to talk about trauma. In some of our beginning ones, we now have over like 180 members of people having conversation and taking that back to their organization. And in Charlottesville, we're actually pushing for organizations that do technical assistance with me for a whole year and put that in their strategic plan. So how do we push the mark forward as a resilient community?
Excellent. All of this work, you are on the bleeding edge and the leading edge, and you're modeling, and I thank you for just sharing, again, your personal story, but the substance you've shared with us today. And I'm also want to thank you, and I'm thrilled you're here. You're actually here to keynote a conference that NRI is hosting with Tanager tomorrow. So you and I are on stage, well, I guess tonight and tomorrow.
Yes.
So looking forward very much to playing with you. And here is your tool number 3. ACEs are not simply a clinical issue to be addressed by the behavioral health system, but are a public health issue that will benefit from broad awareness and involvement. Thank you so much, Allison, for joining us on MediaCom MC22, and thank you, viewers. We appreciate you tuning in to Resiliency Matters on MediaCom MC22, your local programming leader.